Hi, I'm Dr. Laurence at KidsAbility. I'm the clinical psychologist at the clinic. So today I wanted to talk a little bit about screen time. I almost cringe when I say it because I know it's extremely controversial and that a lot of people have different ideas on it. So when I speak to parents and I talk to them about limiting screen time, it's not a form of punishment. It's not to make life more complicated. It's because, from my understanding from the neurological consequences, there are ramifications on too much screen time. Yes, it's important to understand what your child's doing, and so when I speak about screen time, I don't talk about TV time and age-appropriate programs. What I'm talking about is the fast, rapid pace screen changes that is usually in all of the games that our kids are playing. And the reason that it's there is because the marketing people know exactly what they're doing. And so what it's doing is it's trying to keep the child's focus. And you'll notice on a lot of the games, very often they change a lot of characteristics of the game, and it's to keep it appealing, to keep that brain ticking, wanting more. So the emotional part of the brain is the part of the brain that gets lit up in MRI studies when you look at kids doing these gamings. And also it releases dopamine. Dopamine is our feel-good neurotransmitter, right? So it's keeping our kids stuck, keeping them wanting more. But what happens as well, what we know is when one part of the brain, the emotional part of the brain, lights up, the frontal part of the brain switches off. And the important part of that is that the frontal lobe, the prefrontal cortex, is what we need to pay attention. It's what we need to shift between activities. It's what we need for emotional regulation. So when that part of the brain switches off, it's not functioning. And the problem again with that is that part of the brain isn't actually developed until 25. So this part of the brain is what we need to be strengthening, we need to be working it, and it's use it or lose it. So you're not using it because it's switched off, because your dopamine is going and amygdala is going, the emotional part of the brain is going, and so this part of the brain isn't working. So it's not firing together and it's not wiring together. And so that part of the brain that's already not fully developed now is getting weaker. And so that's when we see our kids getting off these electronics and suddenly they're so prickly and they can't regulate themselves. It's because that part of the brain needs to come back online. So we're really actually doing our children a disservice by allowing them lengthy periods of time on these fast-paced video games that a lot of them are playing. So I know it's hard to take it away. So what I would say is you have to get really good at limiting, and so giving a really good time limit on what they're spending, and normally I would say 30 minutes at a trot. So 30 minutes, and then they can have 30 minutes later in the day. They do say for different kids there's different lengths, but even with older kids, even with teenagers, I would try and really limit the amount of length of time they're spending doing these games.